Evening, everyone. It's 7 o'clock, so it's time to start tonight's webinar. Tonight, we're going to focus on fatigue in MS. As you know, fatigue is the most common symptom of multiple sclerosis, affecting approximately 80% of people living with the condition. Globally, this means an estimated of 2.2 to 2.4 million people experience MS-related fatigue, which is an overwhelming exhaustion that is significantly more severe than standard tiredness. To help us navigate this topic, I am privileged to introduce our guest speaker, Stephanie Kurtovich from at Rope Neuro Neurophysiotherapist from Rope Physio. Sorry, Steph. Stephanie has a special interest in neurological conditions alongside fatigue management, breathing pattern disorders, and pain management. Stephanie is passionate about empowering people to make positive changes and be proactive with their neurological journey. Without further ado, Stephanie, please enlighten us.
Thank you so much. Thank you for having me tonight. It's a pleasure to be here with you all. And thank you for that lovely introduction. I'm just going to share my screen. Just do this, make sure that all comes up. Okay. Right, is that all good?
Yes.
Lovely. Okay, so thank you for the introduction. My name is Stephanie. I work for a company called Rope Neuro Rehabilitation. We're based in Grey Lynn and we are neurological therapists, and it is a pleasure to be here today to talk to you about fatigue management in multiple sclerosis. We're a big team. We specialize in all different types of conditions, so multiple sclerosis, Parkinson's, spinal cord injury, brain injury, motor neuron, anything to do with the brain and spinal cord. Here's my lovely team. So if you ever come and see us down in Grey Lynn, we'd be happy to welcome you into Rope Neuro Rehab. I may have met a lot of you before, actually. But if I haven't met you before, it was probably was a few years ago now. I think they just told me it was in 2022. I did this presentation on fatigue management in MS. It has changed slightly, so I think it's quite timely to do it again, just to refresh us on the principles of fatigue management. And also, I'm going to touch base. I wouldn't be a physiotherapist without touching base on exercise guidelines at the end of the session too. Any questions? I believe we're doing some questions and answers at the end of the session, but you're welcome to type them in at the box if you would like to, and I can answer them at the end. But we'll get started about fatigue management in multiple sclerosis. So firstly, what is fatigue? So fatigue is described as a lack of physical and or mental energy that is perceived by the individual or the caregiver to interfere with the usual and desired activities. So as we just heard, it affects up to 80% of people with multiple sclerosis, and it's quite often misunderstood. People can often seem down, depressed, low in mood, and this can often be mistaken when it is actually just neurogenic fatigue. It's not the same as tiredness. So me coming down up at the end of the day's work, saying that I'm tired, I've had a busy week, is not the same feeling as neurogenic fatigue. So tiredness and neurogenic fatigue are not the same things. I quite often like to tell my clients to start calling it neurogenic fatigue to their friends and family, because it just differentiates it slightly from tiredness. So people can have a little bit more of an understanding that what you are experiencing is different to normal tiredness. What I quite often hear from my clients who have neurogenic fatigue is that it may feel like jet lag. So when you've done, if you've ever done a long haul flight, then you are jet lagged, it kind of feels like you've been hit, walked into a wall of fatigue. People have also likened it to taking a medication that is drowsy medication, that real kind of eyelid heavy feeling that you can get with medication that makes you drowsy. What we do know about MS fatigue is that it's unpredictable, and it's not necessarily associated with expending energy. It can come on the morning even after what you would consider a good night's sleep. It's also really important to note that fatigue is not correlated to disease severity. So you can have low kind of, well, be low on the EDS score of your MS, and experience really high fatigue levels. So what that means is that someone might have very few lesions, very few symptoms, but have a very high fatigue level within their body. So it's really important to note that it doesn't have a correlation into disease severity. How common is MS fatigue? So we've just heard that up to 80% of people with MS report significant fatigue. It's one of the most common disabling symptoms. And 55% of people describe fatigue as one of their worst symptoms, even in early disease. And 95% of people with advanced MS report fatigue, the most prevalent symptom across all stages. So fatigue is something that we deal with on a daily basis when people come into the clinic for therapy, because it can affect everything in regards to the way that you can exercise, your sleep, your mood. It really has a huge impact into your daily life. So what is causing fatigue? So there's two things that we're going to think of today. We're going to think of central or primary fatigue and also secondary fatigue. Central or primary fatigue is what's happening within the brain and spinal cord. So we know that we have demyelination and disrupted neural conduction. So what can happen with MS is that you have the demyelination across the axon, and this can slow nerve signals and cause muscle weakness, leading to rapid exhaustion. So we might call this neuroinefficiency, and it means that routine motor or cognitive tasks require substantially greater central nervous system effort, which produces a sensation of fatigue disproportionate to activity level. That's quite long, but I really liked it. I would also liked the term that this is the metabolic cost. So you've got an increased demand of energy within the brain in order to create the movement, both with motor and cognitive tasks. So that is one part of the fatigue that's happening within the central nervous system that we know of. We also know that there's a neuroinflammation and cytokine dysregulation. So the most consistently supported mechanism links fatigue to the chronic neuroinflammatory environment of multiple sclerosis. So the pro-inflammatory cytokines are elevated in the serum and the cerebral spinal fluid, and this disrupts the neurosignaling. These cytokines can signal across the blood-brain barrier, which can alter the brain metabolism and function. And cytokine activity correlates with fatigue severity in a number of studies. So when we're talking about central primary fatigue, we can't have much impact on this. And this is what's happening within the central nervous system. So you have the inflammation response, and then you also have the demyelination, which causes that metabolic cost within the brain. And then we have secondary fatigue, and this is where a lot of rehabilitation focuses, because secondary fatigue is things that we can impact, which can worsen our fatigue level, our central fatigue that we experience. So this might be things like sleep disturbances. So many people might experience restless leg syndrome, sleep disordered breathing. You might experience spasticity at night or in early morning. All of these things degrade sleep quality and amplify daytime fatigue. So how are we sleeping at night? We also might be looking at whether we're getting the 8 hours sleep. Are we getting less? Are we getting more? But it's not as good quality. Depression co-occurs at high rates and shares the neurobiological pathways with fatigue. And so we want to make sure that we're looking at kind of low mood depression when we are suffering from fatigue. Chronic pain, this is something that can really burden people with chronic pain levels. It can disrupt their sleep, it can reduce the movement, so it can make people more sedentary, and it can increase the anxiety and the emotional burden of this. Physical deconditioning, so reduced physical activity, spasticity, motor impairment, lower exercise tolerance, and an increased perceived effort with any task. So when we are we have less strength and we have less cardiovascular fitness, that results in us getting fatigue a little bit quicker than if we were stronger and fitter. And we can also have medication side effects. So a lot of medications for spasticity, pain, and bladder dysfunction commonly cause some sedation and fatigue. And this should always be reviewed by your GP if you're really struggling with your fatigue levels. There's other things that can also impact the secondary fatigue, such as diet, the nutrients that you're getting. And secondary fatigue is potentially treatable at its source. So systematic screening for each contributor is essential for attributing fatigue to the disease process alone. So it's really important that when you are thinking about your fatigue levels, you're thinking about the parts of the secondary fatigue that we can impact. Got a little picture here. So things that we can do to improve our fatigue. So we look at sleep, we look at workload, we look at anxiety, depression, your non-MS related conditions, heat sensitivity, exercise, and diet. There'll be a lot more than that too, but that's what I've got in this picture here. You may have seen this before. So this is boom and bust. So this is what we're wanting to avoid. So that's that blue line. So that's when you have the highest of highs and then you bust and you have the lowest of lows. So we're aiming to have more consistent energy levels throughout the day. This is really common, and we see this a lot in clinic. And what happens is that you're feeling really good, and so you do more. And so you're feeling good, you're doing more, you're feeling good, you're doing more. And then the next day, you really pay for it and you bust it. And you might find that you can't get out of bed, or that you can't leave the house, or that you're extremely tired the next day. It might even be the next hour. So it's when you have these highs and lows with your fatigue levels. This is something that we're really trying to avoid in our day and in our weeks, is the boom and bust pattern. So we're going to look at today some ways that we can establish better management tools to ensure that we have well-managed fatigue. So you might not reach the highest of highs, but you also won't reach the low lows that you experience. So the importance of resting, and we're going to be talking about different types of rest now as a way to treat fatigue and to look at different parts of our day that we can kind of help with our fatigue levels. So rest is the cornerstone of fatigue management, but it's a very nuanced role and most effective when approached strategically rather than reactively. So because the demyelinated central nervous system must work significantly harder than usual to transmit the nerve signals, even routine physical and cognitive tasks deplete energy reserves rapidly, meaning the nervous system genuinely requires recovery time. So you're not making it up. It's not unexpected that you're getting a severe kind of fatigue reaction to a task that you may not think requires that much energy. So your brain is really signaling to you that it does need rest. So scheduled rest breaks taken before exhaustion sets in are consistently more effective than waiting until fatigue has peaked. At that point, recovery takes considerably longer and functional capacity for the rest of the day is often lost. So this is talking about that boom and bust cycle and how preventative resting, so scheduling your rest breaks before you get tired, is really much more effective. We often say that if you're resting when you're tired, it's too late. So making sure that we are thinking about scheduling in those rests. Effective monitoring is important. Pushing past warning signs can extend recovery. So I just want you to have a think now about what warning signs your body might give you before you get incredibly fatigued. It might be that you start dragging your foot is quite a common sign. Catching your foot, feeling a little bit off balance, perhaps you start to get a little bit of back pain. But you might, if you sit and think about it, get a few little signals from your body that you are entering into that fatigue zone. So as we said, excessive or unplanned rest is driven by a boom and bust cycle where a person overdoes activity on a good day and then crashes. It's counterproductive and deepens deconditioning over time. The reason we think it deepens deconditioning over time is because when your fatigue's not well managed, we know that people move less. And we know that people with MS can often struggle to exercise because of fatigue. as being one of the reasons that they struggle to exercise. And so that when they are feeling good, that's also can be coupled with a day of not feeling really fatigued and not being able to move. So it can be quite sedentary in nature. So we've spoken about what fatigue is, and now we're going to really break it into physical fatigue versus mental or cognitive fatigue. This is quite often a topic that people haven't actually thought of before when I ask them what type of fatigue do they experience, because I think we lump fatigue into this one thought in regards to that we're just tired, but we really need to listen to our body and to listen to our symptoms as to kind of what tiredness we are, or I should say fatigue we are experiencing. So physical fatigue might be what, like I just spoke about, when you catch your foot or you might drag your foot, is that your body is having a physical reaction, weakening to those fatigue levels. So the body might feel tired and not have the energy to go any further. So the legs feel heavy. They might start to give way. The upper limbs might start to feel tired. You might feel less coordinated. You might feel less balanced. And your speech might also begin to slur. So physical fatigue is very much the body feels heavy. You feel like you can't go any further. And it's usually in the lower limbs because they're quite high demanding of energy. And that is in contrast to mental or cognitive fatigue. So that's when it might be difficult to find words or follow a thought process. You might find that you have reduced concentration. And this is where you have an overwhelming desire to close your eyes and sleep. This is the cognitive fatigue. So if we all just have a moment, I'm just going to give you 20 seconds just for you to think about whether currently you might be physically fatigued, or we're probably all getting a little bit cognitively fatigued by the end of the day and into our presentation. So just take a moment, think about your day and whether you experience one, both at the same time or at different times. Can be quite handy to write it out too. If you've ever got a moment to kind of write out what signals your body gives you, write out what type of fatigue you're experiencing so you can really grasp your day, because everyone's different in regards to when you get home from work. Is it that you've been sitting down and you've been working at a desk most of the day in front of a computer? So are you actually cognitively fatigued? Is that what you're dealing with in the evenings? There's someone who's got a very physical job might find that they're physically tired at the end of the day. So when we're talking about the physical fatigue, this means that we need to have physical kind of rest periods where we give the body a rest. So it might be things like passive physical rest, so lying down, sitting quietly, or sleeping. This allows our muscles to recover, reduces demand on a fatigued nervous system. So this is sitting down, lying down, and resting. But there's also things like active physical rest, yoga, gentle stretching, really gentle walking. This promotes circulation and reduces stiffness without depleting energy. So this is really, we love to use yoga or just gentle kind of range of motion exercises. So you might do lumbar rotations, you might do some lovely stretching. Where you're not necessarily sitting down and doing and resting the body, you're actually doing something a little bit active. They might call this kind of the active relaxing, but we don't want to be puffing, getting out of breath, or working too hard. It should be just helping settle the nervous system and going into some slow, lovely movements to increase circulation. And then there's also thermal rest. So the body reacts to heat, and we'll go on to this a little bit more soon. But you also might require some thermal rest. So cool environments, which might mean cold towels or cooling vests, allow the body to reset. And that heat is a major fatigue trigger. So I will discuss that more in a few slides. And then we have the mental fatigue. So you'll notice that this is very different to your physical fatigue resting. And that's why it's so important that we can differentiate between whether we are feeling physically fatigued or mentally fatigued, because the type of rest differs for both of them. So cognitive rest. So you might need to step away from mentally demanding tasks. So this quite often is reading, screens, decision making. So at work, you might be taking some time away from your computer screen or not having meetings, because cognitive fatigue in MS is real and often very much underestimated, because some people haven't even worked out that they are cognitively fatigued. And so naming it is really helpful. We need to make sure that we're using cognitive rest breaks throughout our day, because living when you're working or looking after kids or going out with friends or whatever you're doing in your day, it can all be really cognitively demanding, from the driving to the planning of where you're going, to the listening of music, to seeing a friend or having a meeting. That can be all be really cognitively draining. Tonight, listening to this presentation and looking at a screen, it's nighttime. We've got a lot of information coming in, so having a cognitive rest would be really important as well. You also might need a sensory rest. So this is the same kind of concept with reduction of this stimulation from the screens. So reducing the noise, bright lights, and busy environments, because sensory overloads drains our mental energy rapidly. And this is one of the tips that people often give people with MS is, when you're driving, if you're really fatigued, you probably quite naturally turn the radio off, or turn music off, because you just need a sensory break as well, because it can be quite mentally draining. So thinking about how you can reduce the stimulation from your screens at night, turning your phone off, all the things I'm sure you've heard before, which we should all be doing in regards to just reducing the stimulation at night before we go to bed. And then also mindfulness and creative rest. So I'm not sure if any of you have done mindfulness training before, but it's so relaxing. And so mindfulness and guided relaxation reduce stress-driven mental fatigue. So we're thinking about going through a mindfulness program. You can get lots online. You can listen to them or you can learn them, so you can take yourself through them without a screen. But it's also just getting out, enjoying nature, music, art, without the pressure to be productive or to create output. So it's just really giving your brain a rest from kind of high demand tasks. That's why some people can find art really relaxing, is that you're able to go into that mindfulness and guided relaxation. So we have the two types of fatigue, physical fatigue, and we have the mental or cognitive fatigue, and we have different resting for them. But you can also suffer from both. So you might be physically and cognitively fatigued, and that's when you need to think about what type of rest you are doing. So if you were feeling both cognitively and physically fatigued, sitting down on the couch and watching TV wouldn't be the best option, or reading a book wouldn't be the best option. Unnecessarily, you just want to be able to sit and go through a guided breathing technique or something like that. Oh, that's not it. Let me just go here. Here we go. What happened there? Sorry. Okay, so we spoke briefly about preventative resting, but this is a really important part of fatigue management. So it's the concept of resting before you get tired, even having a rest period where you are feeling relatively good. And this is where I struggle to get buy-in from people in regards to, when you're feeling good, that's actually the time to rest. So that's a key way to help prevent the boom and bust cycle. And it might be short rest periods, 5, 10, 15, 20 minutes throughout your day. It might be before a task that you know is going to take up a lot of energy, or it might even be during a task to ensure that you're not resting at the end when you're tired. So you might find that it refuels you with energy, enough energy to complete a task and not be exhausted afterwards, and that's including the next day. So preventative resting has been really successful with clients who might stop their car, well, when they get to work, take 5 or 10 minutes in the car before they rush in, because I think we rush everywhere. You know, we have always got something on, we've got meetings, we've got appointments, we've got kids to pick up. We are quite busy. So making sure that we can really learn about preventative resting and get those rests in, even when you feel like you might not be able to rest, but in a car is really good. In a meeting room before a meeting can be really helpful with preventative resting. So I've just got some ideas here. Having a 10-minute rest in the car before completing the supermarket shopping, having a cold glass of water and a 10-minute breathing break before a work meeting, sitting down for a few minutes before vacuuming and resting, taking a half-hour break before the kids home from school or friends and family come over. That's a really good one. I think when we have people coming over, we tend to rush around getting everything ready, preparing some food or some drink, and then someone knocks at the door and we rush and we let them in. So just making sure that you're planning your time, that you can take the 10 minutes to half an hour just to stop and rest. That will really help you not only during the tasks, but also the next day. So thinking about how does fatigue affect you? I want us to think now about our own fatigue levels and think about timing. Is there anything that triggers it? Recovery patterns, mood, and your engagement with tasks. So if we think about our fatigue, it's thinking about, can we find any pattern with it? Do we always get tired when we wake up in the morning? Is that when we're feeling most fatigued? And it's once we get into our rhythm and we can implement some rest that we feel better. Is it at the end of the day we feel exhausted? Is it after meetings? Having a think about your own fatigue levels. Is it really physical fatigue? Do you just get physically tired when you've done too much? I like people to think about their fatigue like a phone battery. So from the moment you wake up, it begins to drain. And so it's important that you expend your energy efficiently and always have enough energy in the battery. So we're thinking about plugging the phone in throughout the day. I suppose that you can think about the preventative resting as plugging in the phone and giving it a little bit of battery throughout your day. That means that you never end your day in that kind of red under 20% zone. That's the danger zone. So we want to make sure that we're plugging ourselves in like a phone throughout the day with preventative rests to ensure that we keep enough battery to stop ourselves getting into that 20% or below. Think about what's important for you to achieve each day. And we'll talk about the 4Ds and the 4Ps shortly about how you can help prioritize your day. Initially, this is the hard part. If you are currently in a boom and bust cycle, you may have to do less to get your fatigue under control. It's not a forever thing. I always tell my clients we just need to peel back to get a really lovely baseline where our fatigue is well managed, and then we can start adding things back in to keep that well-managed fatigue. But you may have to do less to get the fatigue under control. And with increased self-management and addressing the secondary fatigue factors, you will be able to do more. It's just the first step in getting our fatigue better managed. I was just going to touch on heat sensitivity because the previous slides had spoken about it, and I think it's important for us to discuss. That you may have already noticed this, but there's a temporary worsening of neurological symptoms triggered by a rise in core body temperature. Quite often the symptom is fatigue, that the body might start to feel heavy. You might find that your foot begins to drag. Everyone's different. You might have sensory changes. You might just feel really mentally fatigued. So this is called the Uthoff's phenomenon, and it affects approximately 60 to 80% of people with MS. So it's not a relapse. There's nothing dangerous about it. Symptoms are reversible within 24 hours. And that happens because the demyelinated axons are temperature sensitive, and a core temperature rise of as little as 0.2 to 0.5 degrees C is sufficient to block or slow a nerve. So the heat reduces the voltage threshold needed for an action potential failure in an already compromised axon, which means that basically as you get that temperature change, you don't get the firing, and it can increase your symptoms. And so we've brought it up today because one of the main symptoms is fatigue. So a nice little picture here, because it's not just getting hot from hot weather or exercising are the two main ones that people think of. So we've got hot and humid weather, direct sunlight, even using a hairdryer. People have spoken about changes to their fatigue or their symptoms with the heat exposure. Saunas or hot tubs, hot warm showers or baths, a fever from infection, and also hormonal fluctuations can be a way that we can have a change in that core body temperature. It's quite a low threshold of 0.2 degrees. So you can also get them with the hormonal fluctuations. So we'll talk about how we can manage the heat with our fatigue as well. But the power of self-management. So self-management is one of the most powerful resources we have in healthcare, and it's fundamental to assisting people better manage their health and live a fuller, healthier life. And yet it's one of the least utilized approaches to chronic disease. I thought this was really important for MS because I feel like the more knowledge we have about fatigue, and we should know about cognitive and physical and the different types of rest, and we should know what's happening within the central nervous system and the secondary factors, because that's what we can affect, then that's our self-management, and that becomes a really powerful tool with starting with fatigue management in MS. So I really well done for attending tonight to kind of get this information, because it really can change your fatigue levels, and your fatigue can be better, and it can be through self-management. So a process of increasing knowledge of the condition, symptoms and consequences, and having the ability to self-manage it and take appropriate action. So tonight is about facilitating you to be able to make those changes. So this is the 4Ds that you may have heard before. So we have ditch, do, delegate, delay. So this is something that we would do in regards to fatigue management if we had a busy week or a busy day, that we would sit down and we would write the tasks down that we need to complete in our day or our week. So I quite often do this on busy days, as I might write down everything that I need to do. And then we kind of separate them into 4 categories. Ditch, so these are the energy wasters, things that don't really need to be completed. Do, things that have to be completed by you and things that you love to do. Delegate, something that someone else could easily complete for you. And also delay. So you still need to do these tasks, but these can wait until you have more energy or you have less things or less regularly. So washing your hair, so you can delay that. Dry shampoo or something like that is something that I've used already this week in order to delay that task. So when you have your tasks that you've written down, you're then going to label them ditch, do, delegate, delay. That's going to help you really prioritize what you need to do, how you're going to spend your energy, to ensure that you're not spending your energy or your phone battery on things that aren't important or things that can wait. And that is how we start to get out of that boom and bust cycle and really think about our week and how we can move the tasks across the week. So someone with well-managed fatigue would have thought about tasks that they can delay to the next week, that they can delegate. And delegating can be quite a new concept for some people, but asking people for help, asking them if they can do something for you. Can you drop this off at the post office? Can you pick me up a bottle of milk on the way home? People love to help. So delegate away. Then once you have your tasks, we have the 4 Ps. So this is plan, pace, prioritize, and position. So this is where you might plan your day, knowing your own fatigue levels and your own schedule. You might plan to put your tasks that require lots of energy in the middle of the day if that's when you feel better, or perhaps in the morning when you've got more energy. So planning those tasks out for when you have more energy. Or that maybe you have more ability to complete preventative resting before that task. So looking at your day, pacing your tasks out for the week and the day as well. So thinking about, I'm not going to rush and get everything done in the morning. I might do a task in the morning and a task in the afternoon just to help pace you out for the whole day. Prioritizing the task, which is what we did with the ditch, do, delegate, delay. And we can also do that with the tasks, that we do the task that needs to be done first. And then we can sort the rest out depending on their importance. And then lastly, position. Position is a big one that we don't often think about. But when we stand, we use a lot of energy. When we're moving around, we use a lot of energy. So it might be, can I position myself at the dining room table to peel my vegetables? Or perhaps you've got a stool up at the kitchen bench that you can sit on. If you're waiting for someone, can you lean on the wall just to help your position be less energy demanding? Thinking about different positions to help preserve your energy levels can be really helpful. So we've got the 4 Ds and the 4 Ps: plan, pace, prioritize, position. So some tips and tricks, and this has been from the MS community. It's quite often, it's so lovely to have sessions because people tell me what's really helped them, and then I can pass this on to help you, hopefully. So break larger tasks into smaller tasks that can be completed throughout the day. So quite often people might prep some vegetables in the morning. They might do some of the dinner, or they might make lunches for the week and the weekend, just something that can reduce the energy demand throughout the day or the week. Food shopping online, click and collect, a great way not have to walk up and down those aisles. And also people who have physical fatigue might find that if they are in the supermarket, looking at positioning of leaning on a trolley, even if you don't need a trolley, is superior to carrying a basket because that's more energy demanding. So even looking at positioning with shopping, that if you're not going to click and collect and you're going to go up and down the aisles, great. Can we change our position to make it more energy efficient? Dog cooling mats under sheets during summer. I'm sure they must just have cooling mats now that aren't dog cooling mats. Turning off the radio when driving. And then positioning for tasks that we spoke about, like having a perch stool in the kitchen for when you're peeling potatoes. Prepare for tired days. Always ensure that there is something in the freezer that you can have for dinner. I always find this really helpful just in general, just to have, after a long day at work, and if I've gone and done some exercise and then in the evening coming home and having something that I can easily pull out for dinner is much easier. And then also thinking about the essence of a task. So meeting a friend at home instead of a busy cafe for coffee. The essence of the task is seeing your friend and having a coffee. And what makes that really difficult is the driving to the cafe, the finding a car park, the cognitive task of that. A busy environment, so a sensory overload, becomes a very complex, energy draining task. So the essence of the task is to have a coffee with a friend. So can you make that at home where you've got less demand, energy demand? So a few points with resting. So resting should ideally be about 20 minutes, but no longer than 2 hours. And if your afternoon rest is interfering with your evening sleep, it's too long. If you're resting for over an hour and it's interfering with your daily life, I would really recommend seeing someone with experience in fatigue management because we would want to try and implement different rest types in order to ensure that you aren't having to rest too long in your day. Rest, as we said before, don't have to mean that you need to lie down. It could be resting in the car before jumping out to complete a task. So we're starting small. We'd like to do some sleep testing. If you are needing a rest, is 20 minutes enough? Quite often people feel exactly the same whether they've had 20 minutes or 1 hour. So it's ensuring that you really testing how much sleep you actually need, and always put an alarm on your phone to ensure that you don't oversleep, because as I said, you might sleep for an hour but have no extra benefit to that, because sleep doesn't directly impact the fatigue levels by a certain amount. And as I said, if you're not feeling refreshed, you need to look at something else in those secondary factors, and working with a rehabilitation professional can help you with that. Right, we're just going to have a quick rest before we go into exercise. I've only got a couple of slides on exercise, but as I said, I wouldn't be a physio if I didn't touch base on it. I quite liked this cartoon that I found online today. So if you haven't exercised in a while, you may need to stretch and warm up before you stretch and warm up. I relate to this after getting back into a sport and getting injured every time I turn up to play tennis. So it's important to stretch and warm up before you stretch and warm up. So let's just stand up if you need to, move your body. If you want to just close your eyes for 1 minute, we're just going to take a little bit of a pause, have a glass of water. I'm acutely aware we're having a fatigue management presentation in the evening, and it's already been 40 minutes. So just have a moment, roll your shoulders. Okay, we're nearly there. Exercise and MS. So exercise is considered the single most effective non-pharmacological symptomatic treatment for MS. So it's proven to improve fatigue, walking ability, strength, mood, cognitive function, and quality of life. And the evidence suggests that exercise may have neuroprotective and disease-modifying potential by influencing the neurotrophic growth factors. So basically what that means is that when we exercise, it's neuroprotective, it protects our brain and our spinal cord, and it depends on kind of what exercise we're doing. So it's very different from it might be high intensity interval training is very different to doing balance work. But exercise is safe, and it should be prescribed alongside medical treatment as early as possible. So physiotherapy guided exercise is gold standard, because we're able to look at the balance system, to look at the exercise prescription in regards to cardiovascular health, strengthening, coordination. We also might look at dizziness if you're feeling dizzy. And so there's a lot of reason to see your local physiotherapist who has experience in multiple sclerosis. And throughout the research, we know that MS patients who had exercise training had a 27% lower risk of relapse compared to control. So that's those with relapsing remitting. And that's significant. So there's definitely reason to exercise. So what are the guidelines? So people with mild to moderate MS are advised to perform at least resistant exercise twice a week. So that's moderate intensity, so 10 to 15 repetitions to 1 to 3 sets. And that's 60 to 80% of your 1 rep max. So you might need help working out what your one rep max would be, and then you're looking to work between 60 and 80% of that. So we want to be lifting pretty heavy, but we should be able to do 10 to 15 reps for 3 sets. And then also aerobic exercise 2 to 3 times a week, moderate intensity for 30 minutes. And that's 60 to 80% of your maximal heart rate. So working hard. Now, this is the gold standard. This is the goal. We're not going to go out tomorrow and start doing this because that wouldn't be great for fatigue. But what we're trying to build up is we're trying to build up to the guidelines of resistance and aerobic exercise. And then we also have to put into this, we may have some problems with balance and coordination. So we also might need to put in some balance, physio-specific or physiotherapist-led exercises into our program. But the good news is aerobic and strength sessions can be combined on the same day. So this will allow one rest day between strength sessions at the very least, because you only need to do 2 a week. So we can do them on the same day, which is good news. So for those who are based in Central Auckland, or you may have heard of us before, Rope Neuro Rehabilitation, we have an amazing team of physiotherapists and occupational therapists. And if you've come to us before, you'll know that we have a great big gym space in Greyland. So I would recommend anyone who's struggling with neurogenic fatigue, exercise principles, exercise tolerance, balance, uh, any symptoms that you would like a rehab professional to have a look at, come and see us. So we're based in Grey Lynn, and come and have an initial assessment. So what to expect, an individualized assessment focusing on your areas of concern. Tailored sessions working towards achieving your goals, including balance, strength, flexibility, posture, walking, transferring, reviewing your current exercise program, optimizing it, creating new ones to really look at your deficits or your impairments, and working towards your exercise guidelines in a safe manner, and always fatigue management and guidance. And if you have any questions that you'd like to ask me outside of this presentation, you're more than welcome to contact me. My email is below, which is stephanie@ropeneurorehab.co.nz. I would be happy to help. Just give me an email and I will get back to you when I can. But yes, thank you so much. It's been an absolute pleasure. I'll just stop the share. Oh.
Thank you so much, Stephanie. It was absolutely amazing. I mean, so much sensible advice, how to manage everything, and the difference that we sometimes not aware of the between cognitive and physical fatigue and rushing all the time and not allowing ourselves to slow down. We do have some questions, and I encourage you, the participants, to ask questions. Just keep them of general nature. One question is, would it be better to do 2 Pilates sessions and 2 gym sessions per week, or 4 gym sessions per week with no Pilates? Gym sessions include weights and cardio. I think this is quite.
That's all right. I'm happy to answer that one. That's a
Yeah,
great
sure.
question. I um I
Thank
love
you.
Pilates. I go to Pilates twice a week myself. I think it's a fantastic exercise. Uh, what you need to make sure is that you're reaching the guidelines first. So my advice would be that in order to have the wonderful benefits that are neuroprotective, and that are going to help reduce the risk of relapse, really we need to making sure that we're cardiovascularly working hard, and reaching the guidelines, and also that we are lifting relatively heavy. We tend to lift heavier in the gym than we do in Pilates. So Pilates is working on the endurance of muscles. So that can be kind of exercises for longer periods where you get that kind of deep burn. Fantastic, absolutely a great exercise. But it would be considered as well as your gym-based exercises. So heading to the gym twice a week to which you're doing, which is fantastic, to lift those weights. Um, I think if you enjoy Pilates and you're doing a strength-based session twice a week, fantastic. You're doing it. So well done, you.
Yeah, as your another colleague of yours from Rope says, anything is better than nothing. So
Yeah.
just keep on moving.
I think
Um,
that's so right in regards to we can all tend to be a little bit sedentary these days, just
mm,
because of the way that we're working and the way that we're living. We drive to work, we sit down at work. So, any movement is good movement, and the
Absolutely,
aim is to reach those guidelines.
absolutely. There is a question here, Steph, about if you have any recommendations where to buy cooling mats under sheets, if you know.
I actually don't know. That's a really good
Mm.
question. Not off the top of my head. I usually do
Yeah,
the trusty old Google search.
yeah,
Get them from all over the place.
yeah. Um,
I,
Diane?
I did just Google that actually, and while people are online, and it's got Ecosa, ECOSA, have them,
Yes,
and
yeah, lovely.
Briscoe's, it's a Hilton Cool Max mattress topper,
Yeah,
maybe.
nice. I also, when I was living in London, it got really hot in the nights, only for like 2 nights a year, but it used to get really hot. And we used to get freeze like a hot water bottle and wrap it in a pillowcase.
Mm.
Just having that cooling kind of really cheap, really easy, freeze a hot water bottle, wrap it in a pillowcase, and that was worked so well in just cooling you. Even just having it next to you in the bed really, really helped.
Mhm. And
Yeah.
Steph, is there any barriers that you see that people face when seeking help for fatigue?
barriers and sorry, say that
that
again.
that do you see any barriers that people face when seeking help for fatigue?
I think that there's just not the knowledge. I think that really people think fatigue is tiredness. And
Mm,
I think you really need to get a health practitioner, and they are across New Zealand. There's amazing neurological physios and occupational therapists who will know about neurogenic fatigue. And the barrier, I would say, is that there is just not enough knowledge within even the medical profession or the healthcare profession in regards to how severe and limiting it can be. Let
mm,
alone the kind of principles of how to treat it. And it can be really disheartening. And I think it takes kind of one moment with someone who doesn't know to feel like you can't do anything.
mm,
The other barrier I think is that it's really hard to measure. We can't give you two numbers and say, okay, this is your fatigue now and this is what it was. So it's
mm,
self-reported, which is fantastic because that's all that matters, that you're feeling better. But in regards to, we can't give you numbers of how much things help
mm.
because it's all so individual.
It's interesting because people are asking about the clinics similar to Rope around the country.
We
Someone's
have, yeah,
asking
why don't
about
those
Christchurch
people
and Dunedin, another
Yeah,
one.
those people should absolutely give me an email because we do have some, not under Rope Neuro, that
No.
Rope Neuro works with amazing neurological therapists across New Zealand. And I'd be happy to get people in touch with someone in their area
Oh, that's
to
fabulous.
help them who I know has experience with MS. There's a fantastic therapists across the country.
Oh, thank you for that. That's really helpful. Um, I was thinking of cognitive fatigue that people quite often experience when they are at work, and there is, they need to have a break, as you said, 5, 10, 20 minutes. And then one of the main barriers is, how much do you disclose at work about what you are experiencing? And what
Hmm.
is your view on that? About, I
I
don't know,
think,
how
yeah.
open and how
I
to educate maybe your workmates on MS fatigue, you know?
Yeah, I think where I would start, if you're comfortable sharing that you have MS with your workplace, or even
Mm.
not, you wouldn't have to say that you had MS, is just saying that you have neurogenic fatigue.
I like that.
Lots of people have
mm,
neurogenic fatigue for a lot of different reasons.
Mm.
It might be from concussion, it might be from a brain injury, it might be from something neurodegenerative. So no one knows. So you could keep it open like that. But if I'd also really ensure that the breaks I'm taking at work really fit what I need, because it's really hard to find a place at work where it's really quiet. Some people are better off going to their car, and
Mhm.
sitting in their car where they can have that environment where sensory kind of is all kind of shut out. Um, and just check that my breaks that I'm having at work, it might not be social, but maybe half of your lunch break does need to be in a quiet place, which is really hard because it can impact you socially as well. And then it really depends on how comfortable you are to disclose
Absolutely.
your MS, but there's a lot of education. So I would definitely start with calling it neurogenic fatigue and
Mm.
just letting people know that the way that you can work your best is to have an environment that really allows for cognitive rest. And this is what I need for cognitive rest.
Oh, that's fantastic. Thank
mm.
you. That really, really helps. I don't think we have any more questions, Steph. And thank you very much for the presentation. It was absolutely fabulous and so much information. And yeah, so useful. Thank you. And